So I'd be grateful if everyone could stand. So I'd like to acknowledge that we're gathered here today on the traditional, ancestral, unceded territory of the Musqueam, Squamish, and Tsleil-Waututh Nation. We offer our sincere appreciation to them and our gratitude for allowing us to work and study each day on their traditional territory. And for those who've come from away, maybe take a moment to think about the territory on which you work and play with gratitude as well. One of the most important things that's happened for a lot of us over the last 5 years in particular has been the work of the Truth and Reconciliation Commission. And one of the first things that's really, really important there is actually to think and to learn and to be with the truth of what happened to our Aboriginal peoples over the last decade. And is still recurring in the children and the lives of Aboriginal children and families. One of the most important mechanisms for us at HELP for thinking about the truth, but also for us moving to reconciliation, and that means acting every day in a way that we honor the truth, is to work with our Aboriginal Steering Committee. And the first thing that I want to do is welcome Diana Elliott, who is one of our founding Aboriginal Steering Committee members, to the podium to give this meeting a blessing.
I'm Diana Elliott. As mentioned, I'm a member of the Aboriginal Steering Committee. I'm also a Coast Salish from Cowichan Tribes in Duncan, BC, and Trona from Chesapeake First Nation in Port Alberni. So I'm glad to help us start the gathering today in a good way by asking everybody to do the greetings of the four directions with me. So if everybody would turn facing east. It's hard to tell because I can't see the North Shore Mountains, but I have a cheater compass. Okay, everybody please raise your hands. And as we stand facing the east with our arms open, we ask the east direction, which is associated with air, with new beginnings, thought, inspiration, poetry, intuition, and mind. Say good morning and thank you to the east. Be grateful for the gifts of inspiration, creative thinking, and a new day. These are qualities of the east direction. Open, breathe, and connect. Now I ask you to face south. South is the direction associated with fire, with passion, will, forward movement, your physicalness. Say good morning and thank you to the south. Be grateful for the gifts of passion, creative energy, courage, fitness, and your ability to make things manifest. These are the qualities of the south direction. Open, breathe, and connect. Now we face west. West is the direction associated with water, with womanness, with feelings, the ability to go with the flow. Say good morning and thank you to the west. Be grateful for the gifts of a loving heart, the ability to go with the flow, to feel your feelings, to explore your depths. These are the qualities of the west direction. Open, breathe, and connect. Now facing north. North is the direction associated with earth, with grounding and balance and solidity, the character traits of strength. Say good morning and thank you to the north. Be grateful for the gifts of hard work, strength, grounding, perseverance, and endurance. These are qualities of the north direction. Open, breathe, and connect. Now you are standing in your center. Open your arms and look up. Open and connect with the power beyond our Creator and our universe. Be grateful for this wonderful opportunity to experience being you and enjoy your day. And remember that you're always you're a spiritual being on a human journey. You are a unique, unrepeatable gift. Decide to be the best you can be today. Be a gift to the world, and just for today, and one day at a time for the rest of your life. Housekeeping. Thank you. Have a good day.
So these are the other members of our Aboriginal Steering Committee. And the way that I like to think about the role that they play for us up at HELP is by inspiring us, showing us the path to the top of the mountain so that we can all do the climbing. It's not up to any one individual, it's up to us all to be on that same journey together. So thank you, Diana. That was a wonderful opening to this meeting. I'd like to give a huge welcome to everyone in the room. Old faces and new. It's always wonderful to see new people, but I love these gatherings because there's just so many old friends here who've been committed to this work and working with HELP for so long, so welcome everyone. For those who come regularly, you'll notice that we're a little bit smaller in the room today, and one of the reasons for that is that we have people joining us from across the province, 90 webcasts, I understand. And some of those are group webcasts. So the reach of this meeting is it's broad, it's deep. We've got people joining us from Toronto, Hamilton, Chicago. We've also got people from across Canada, BC, the north, all the way through to the Kootenays, about 10 communities on the island. So welcome also to everyone who's joining us from on the webcast. HELP recently did some work on its strategic plan. It was a very substantive group effort within the organization with everyone involved, from staff to faculty, and actually external people were drawn into the process. And we reconfirmed our vision and tweaked our mission slightly to be a little bit clearer. So our vision is all children thriving in healthy societies. And my deep belief is that that's actually a shared vision with all of you. That's not our singular vision. It's something that actually connects us with the people out in community and across British Columbia in Canada who do this same work with us. Our mission is unique, and it's about connecting research and practice. And today we'll hear a lot about that research to practice connection, the idea that it's not just important to gather data and do good research, but actually to use that to good effect for children and families. So there's one very important person missing here today who was instrumental to the creation of our new strategy, and that's Kim. Kim is actually in Paris at an OECD meeting about Education 2030. But she sent a little message to me this morning that I just want to read you because she was really sad that she wasn't going to be here. She said, although I'm unable to be with you because of this OECD meeting, I wanted you to all know that you're in my thoughts today, and I'm looking forward to hearing how everything goes. So she's really clearly with us in spirit. One of our strategic goals, and this won't be a surprise to many long-term HELP Connect colleagues, friends, mentors, partners, is the achievement of a monitoring system. So not just simply the important foundation that we've created for ourselves with the EDI, but expanding that across the life course and gathering data from 18 months all the way through, and actually connecting with data from birth, but gathering it all the way up to school leaving so that we have these long-term data trajectories of children that are more powerful for us in terms of decision-making, policy-making. There's several important things to say about that we care deeply about the fact that these data are population level. That gives us so much more power and richness to be able to support communities in the work they do. It's very important to us that they're individual level data so that we can link them, that we can actually then give data back to communities that represents your children. They're not some children, they're your children. And that they're developed explicitly to support action in communities and in government. So the way the tools are developed, the way we analyze the data, and the way in which we report them is actually very intentionally done to support change for children and families across British Columbia. So everyone will know we started with the EDI. We're just in the middle of Wave 7, and we'll be going into our final data collection soon for Wave 7. You've seen those data reported many, many times. There's one little update on that I'll give you. But I wanted to say a couple of things about some of the new tools that we're working on. The TDI is our newest tool. It's a parent-completed questionnaire. It takes about 15 to 20 minutes. Focuses on toddlers, 18 months to about 20 months. It's a parent-completed questionnaire, and it's been piloted this year, or in the last 6 months, in 10 different sites across the province, and we have about 400 records. So what that helps us with is really understanding how the tool itself needs to be adapted to be as effective as it can be. And it also helps us understand how we might link those data to some of our data sets so that we're sure that it's valid and reliable. Looking into the next phase, there's obviously ongoing tool testing. We're beginning to look at some additional pilots that will go into more depth about how we might go to scale in community. And we're continuing to understand which organizations are those that would particularly like to use this tool and the data that we generate from it. So a really exciting advance on the toddler development instrument. The Childhood Experiences Questionnaire is one that we've talked about a couple of times at these events, but just a quick update on that. With funding from the Early Years Office, we were able this year to actually pilot in 10 school districts at scale. We now have 1,250 records, almost, check records that were gathered from parents this year. The check is a questionnaire that parents complete in that first period of school when they're either dropping the child off or in the week following or during that first entry period into kindergarten. And actually, I think it's 11. Did I say 10 or 11? Did I say 10? I said 11. It's 11. 11's go. If anyone wants to know anything about it, Melanie and the team are sitting down here, and I forgot to actually acknowledge Madeline. Where's Madeline? Madeline is over here. If anyone wants to know anything about TDI and the progress that we're making on TDI, Madeline is your person. And then there's some Czech folks. Do you want to sort of, Ryan, Shalan, Melanie, make yourselves known? There's a bunch of Czech folks down here at the bottom. They'll give you more information. But what we've also been able to do through Czech is actually build a really flexible data collection and reporting system that allows us very fast turnaround reporting now within a day for individual child reports, and then a week for school reports. So really been able to do some new development that gets data more quickly back in the hands of people who need to use it. Looking forward, we're looking again to expand it. But at the moment, we're beginning to settle down and try and really understand how these 11 sites went and what we can do going forward to be able to build on our learning. EDI, as I mentioned, we're into the middle of Wave 7. The one thing I did want to mention as a quick update with EDI is subscale reports went out in September. By huge demand, we had a lot of demand for getting subscale data out, and our whole help team has spent a lot of time, a labor of love I call it, trying to put these reports into a usable form for communities. So they're out there now, and Sally is happy to hear from people who need or want to have some time with helpers to interpret those data and use them effectively. The MDI, so a quick update on the MDI. We are into our largest data collection year ever. We're working with 28 school districts this year towards an expected number of MDIs in the range of around 28,000. We really do feel that the plan to try and get full provincial coverage, which is what we really need to make these data as powerful as they can be, is beginning to come to fruition. We've also been working across the country with a number of school districts in Ontario. I've worked with the whole of the territory, in the Northwest Territories, school districts, the Calgary Catholic School Board in Alberta. And the one that I'm really, really excited about at the moment is that we're working closely with the first ever Manitoba First Nations school system to be able to use MDI in their planning going forward. So some really interesting learning there. And just one more highlight from MDI, some amazing work by our knowledge translation team to develop something called Discover MDI, which is, it's an interactive resource packed with information not only about the MDI, but how to use it, how to take it to action. It's also got a network, a learning network associated with it, and champions that you can reach out to so that we can see peer learning and cross-learning across the province, and it's not always coming back to us because there's so many people out there who have become experts in the MDI. The final update that I want to give is relevant to today, and it's the emerging idea of a Systems Leadership Center for Children at HELP. So one of the things that we've done a lot of over the years is do meaning making with data. We collect data, we analyze it, we report it, and we take time to go out to communities and try to understand those data with you. What we want to move towards is a much more engaged process of actually taking those data to action. So the idea that it's not just important to understand data, but actually deeply to know how to use those data and how to think about how you build capacity around that. So you'll hear a lot more from Joanne, who's working directly with us to do this work at the moment, but the idea is that HELP acts as a bit of a housing or a secretariat for all those engaged in that important work of community capacity building. And my hope is that we'll all be engaged together in that work. There's a lot of expertise in the province. What we want to do is catalyze and support that process. So just a little bit of housekeeping. Sally's going to come up and say a few words that you really, this is the important information actually.
Important and rapid fire, I promise. We're going to get on with the show. Okay, so a couple things for today. Presenter slides, yes, they will be available, and we will have them on our website in about a week from now, along with the webcast recording that is happening today. So you'll be able to find those, and Amy will make sure that those are circulated to everyone via your registration email. So expect that in about a week. Tomorrow you can also expect an evaluation survey to be sent out. We so appreciate when the 37% of you complete that evaluation. So if you could do that again this year, and that includes people on the webcast as well, it really does help us shape and inform what we do for our events, big and small. So lots of space for you to tell us what you'd like to see in future as well. We are filming, two types of filming today. So there's a webcast in the back left corner here for our webcast participants. And we also have a volunteer, Sebastian, who is in the back right now, who has offered his expertise and skill to help us create a new HELP video. And this is really hopefully going to help tell the story of HELP. What we'd love is to have some of your perspectives be involved and incorporated into that video. So Seb will be doing some large group shots throughout the day, and also if you feel so inclined to answer a few questions, he would love to speak to any one of you. So you can track down Seb or Amy for that as well. Okay, webcast participants, as Pippa mentioned, we had almost 100 webcast participants register for today from across the province in Canada and even in Chicago, our friends at the Erickson Institute. And 12 of those groups are actually parties, viewing parties that are joining us today. So a quick message for them, hello and good morning. Please ask your questions in the chat box today. We're really doing our best to ensure that your questions for the panelists and for the presenters are incorporated into today. So I will be moderating the question box, as will our technical experts at the back. Sorry? Oh, panelists. Yes, you can ask your question to the panelists, all panelists in the chat box. Please do that. And finally, we would love for you to have your phones on silent, but we would also love for you to be tweeting and sharing your learnings and images with the world today, and using some of our Help Expo hashtag, as well as our Help Twitter handle, and there's also Kim's Twitter handle and Pippa's. That's about it. Thanks.
Just a plug for the video. Help is about the family that we have out here. And it's very important to us that actually the work that we do is also reflected through your eyes and your words. So if you're even vaguely inclined, it would be wonderful if you could do an interview. Okay, so the theme today is building connected communities. So it's about not the data, but how we use data to be able to support the community work that happens for our children and families in BC. And I just want to put that in context in terms of the kinds of conversations that we have about how do we actually make change for children and families. It's the conversation that we constantly constantly have. And there's a number of different ways, 3 different ways, that we can think about how we affect change for children and families in the work that we do every day. The first is to consider the importance of what I call intervention. So those are policies and programs and services and everyday practices. And there's a few other words that are floating around these days for this kind of work. And it's the kind of work that we tend to actually be quite good at. We tend to frame our worlds in terms of programs and services, and generally interventions. The second thing that we can think about, and the area of work we can consider when we think about change for children and families, is the idea of policy, federal, provincial, municipal policy. And this is absolutely critical because children exist in a container that is defined by policy at some level or another. At the same time, policy is hard to shift. It's a longer term strategy in terms of, and it's often unpredictable in terms of how policies will affect children and families. The third area that we can think about is the idea of community systems, networks, and collaboration, the kind of work that many of you are invested in every day. And that's what we're going to focus on today. It's not to say that interventions or policies are not useful, but that as levers of action, we need to be considering all of these as things that we need to be paying attention to. And so today, the lever of action that we particularly want to focus our attention on is this idea of community systems. So that's the way we structure ourselves. It's the way we work together, the processes that we put in place to ensure that the system that wraps around children and families at the center is working toward the objective of better outcomes for children. The other theme that's going to come up a lot today is the idea of policy and practice. I introduced SLC to you. One of the things that is really important to us is that we not only work to improve capacity in communities and think about those systems, but we do really good research on what works and what doesn't from a community systems perspective. And so you'll be hearing from both sides of that equation, both practice and research today from Brenda and Joanne. So the schedule for today, broadly speaking, it might change a bit, but there you go. That's sort of what we're going to be doing. And we're going to be aiming to finish by 12:15 at the latest. We may finish a little bit early, depending on how things run. So the people who are going to be here, I really want to get going with them. Brenda Poon, who is an assistant professor at HELP, as a long-time HELP professor, and has now dedicated her time and energy to the research side of this equation. What does the research tell us about what is important in community systems and what we should be paying attention to be able to improve our practice? She's going to be reporting out on 2 particular, or she won't actually report out on the studies, but using data from 2 studies. One is an evaluation of the early years centers. One is another study that was supported by the Institute of Health Systems Transformation and Sustainability, and I see Mark over here. Welcome, Mark. That was looking at, it's a project named Sustaining the Village. So it's about how network and collaboration is critical to influencing vulnerability rates. So Brenda's going to talk to us about her findings from those 2 studies. Very fortunate to have got 2 new research grants that are going to continue that research into the future. Then Joanne is going to take us through the practice component. All of you, well, not all of you, I shouldn't say that. Most of you will know Joanne. It's a huge privilege to have her back closely associated with HELP. We were successful in getting a Max Bell Senior Policy Fellowship that's supported now at HELP, and Joanne is holding that position. My dear hope is that actually in the next year we'll be able to give her the title of faculty. She spent many years at HELP as staff, and what I really want is to try and give her an adjunct faculty title. But we'll see how that one goes. So Joanne is really going to lead us through not only the work that she's going to be doing under the Policy Fellowship, but also working with the panel to look at what does this practice look like on the ground, and what can we learn from 4 wonderful practitioners about what happens. And those 4 wonderful people are Lynette, who has been a close friend and associate of HELP for a long time and has really spearheaded some of the use of the TDI up in the interior. Ada Mawson, just a live wire and a dedicated, committed friend, and working on the island with, I think, 20 nations, 21 nations. There you go. So Ada will be talking about a little bit about what she's been doing. Maureen, I haven't seen Maureen. Oh, She's here. Okay, so Maureen, very closely connected, and I can't thank Maureen enough for the advice and guidance that she's given us at every level over many, many years. And then Dave Phillips, who I can't see, but maybe he's stuck in traffic because he's coming from Richmond. Okay, so we're really privileged to have some amazing people here to reflect on the practice side of what we're talking about, which is building connected communities. I'm going to hand over to Brenda.
Good morning, everyone. It's such a pleasure to be here to talk to you about our emerging research in community systems. It's been fantastic. I've had the opportunity over the last few years to travel to different communities. It's been a real honor and a privilege to meet service providers in different communities and also with parents and caregivers as well, and really meeting parents and families, children and families where they are, going to different centers and different programs. And it's been great, and it's reminded me of my days when I was working in childcare centers and in preschools, and brings back some fond memories. And actually, as an aside, one of the things that happened most recently is I was in the field in the community collecting data, I think from a Mother Goose program, and it was fantastic. I was talking with parents, I was with children. I felt I collected really great information. When I got back to the hotel and got ready for dinner, I was just looking in the mirror and I looked behind me, and on my sweater I had a series of little handprints all over my back, and I wondered, where did those come from? And as I thought back of the day, I realized that when I was in the Mother Goose program, I had a little guy behind me who was using my back as a makeshift drum, and didn't realize that that happened to be after snack time. So that meant I had, I don't know, maybe applesauce or something all over my back. So yeah, it really was something like a souvenir for the day, something that I don't usually get on my day-to-day basis when I'm at UBC. So lots of fond memories there of being back with kids and being back with families. So I'm really excited to talk to you today about our emerging findings in this area around community systems, and in particular talk to you about what we're learning in terms of early years service systems and collaborative planning structures in BC. Now, it might seem like this is a pretty new area for help, and it is. It's emerged in the last few years especially, but really it is rooted in the long-time work that we've been doing in relationship to the early development instrument and the EDI. So we know from our Wave 6 data that we still have a third of BC children who are developmentally vulnerable. And we have gathered this data over the last 16, 17 years through the early development instrument, who I know the majority of you in the room will be very familiar with, but very briefly, it measures assesses 5 domains of development, including physical health and well-being, language and cognitive development, communication and general skills, emotional maturity, and social competence as well. And what we've seen as we've mapped over the years the rates of vulnerability, we are still seeing that 1 in 3 children developmentally vulnerable. But what we're also seeing is that there's quite a lot of disparity across the province when we look at geography. So if we look at the school district level, for example, we're seeing that there's a range in vulnerability rates from 9% to 53%. But then when we look at the neighborhood level, we see that that widens even further. So when we look at the neighborhood level, we're seeing a low of vulnerability from 9% up to a high of 60%. Now, over the years, through the wonderful maps that have been generated and so on, there's been the ability for us to share that information and the maps with communities over the last few decades. And many communities have responded to this and promoted the focus on promoting early years and healthy development from the early years onward. They really mobilized in the form of network building, as well as a long list of initiatives that have really focused on providing that strong, healthy start. We also know that in BC we have a long tradition, a long history of collaboration in support of the early years, with more than 170 early years tables across the province, and support from Success by Six, Children First, and others. And we've seen collective action from many tables, drawing from the EDI to inform areas for priority and community action. A little bit more about the roots of this community systems work. Some of you in this room may recall that our founding director, Dr. Clyde Hertzman, and Joanne Schroeder used to do their roadshows across the province, and they would talk about what we think those differences are that make a difference in terms of seeing these disparate rates of vulnerability, these inequities in terms of childhood developmental vulnerability. And if you may recall, they used to talk about 5 key factors, and those 5 key factors were strong intersectoral leadership, a focus on local research, including EDI outcomes, alignment between the school system and the early care, learning, and development sectors, and a plan to increase access to service by decreasing barriers for families, and also a commitment to advocacy. So it was through this work and hearing some of the feedback that Joanne and Clyde were gathering about what folks were saying about what differences seem to make a difference. And through this anecdotal evidence, we learned about these 5 different factors. And this was really a seed for this community systems work, in wanting to dig deeper and understand what could be happening at a community level in relationship to intersectoral work, leadership, cross-sectoral work, increasing access through service delivery structures, for example. We wanted to dig into that, and yet we didn't yet have a research base for that, and that was one of the impetuses for where we are now, which is trying to generally understand complexity in communities, this complex community systems work, with that overarching question about what community systems level factors might be contributing to different rates of developmental vulnerability, such as what we see with the EDI. And we call it complex for another number of reasons, and I'm going to provide a bit of background about why we would call this a complex system. So, I'm drawing from a framework here from the National Academies of Sciences, Engineering, and Medicine. It's just released in 2017, actually. And some of the complexities of this are because our inequities that we see in developmental health vulnerabilities, for example, are affected by multiple determinants, multiple intersecting social determinants. And those determinants can be at the level of education, the level of income and wealth, public safety, the physical environment, education, and so on. And it's this complex interplay of factors that has an impact on the health inequities that we see. Now, what's happened with the National Academies of Sciences and Engineering and Medicine is they've also outlined 3 elements of what they say are 3 key elements of community efforts to address health inequities. And those 3 factors are having a shared vision and value around promoting health and health equity, increasing community capacity, and fostering multisectoral collaboration. And as much as they identify the importance of community action and community efforts, it's really important to note that community efforts are not viewed as the sole strategy for addressing developmental health inequities. Communities themselves really exist in a milieu of federal, provincial, and local level policies, forces, and programs that really enable and support, or on the other hand, can interfere and impede with the ability of communities and their partners to address the conditions that lead to health inequities. So as much as there's power of community actors and as much as it is necessary and essential to have community action, it's not necessarily a sufficient ingredient to promote health equity. Community action requires a supportive context, and that needs the support of high-level policies and ways to address some of the structural inequities that we see in these determinants of health that I've outlined here. Another layer of complexity is associated with that 3rd point here around multisectoral collaboration. So we see here on the right that in an ideal world, we would see our multiple sectors working together synchronously to address the needs of families. But we know it's not that easy. There is a level of complexity associated with multisectoral collaboration. And some of that complexity is that competing or collaborating organizations, I should say, often have different goals. They might have different funding streams, different stakeholders as well. Values, norms, and ideologies may develop over time within organizations, but it can still make it difficult to accept working with other organizations as well. At the same time, organizations may recognize the value of collaboration, but in practice, it can be very difficult to make it work. And actually, there was a review done by Fawcett and Associates in 2010, and it was a review of some of the factors that might contribute to poor performance in achieving population health goals like health equity. And there was a challenge in terms of, the challenge identified was in engaging stakeholders, engaging those stakeholders at multiple ecologic levels and building those collaborative partnerships in population health. Another layer of complexity is that there might be this tension in wanting to have different degrees of sector involvement, but not necessarily in those discrete boxes that I showed you on the previous slide. Really, the tension is around trying to blur those lines between sectors and having ways to have primary unifying goals, a set of mechanisms to provide supports that, in this case, wrap around families, wrap around communities to an extent where they're meeting the needs. Families are at the center, whereas in the previous model, families weren't at the center. Sectors were really working to provide supports, but really it was sector focused. In this model, it is some attention to wanting to put families at the center and really blur those lines. So trying to navigate that can create those complexities too. So that's one high-level aspect of thinking about multisectoral collaboration that happens in communities. But what about if we think about the complexities of the experiences within the service delivery system? So what are the experiences of families trying to access services? What about the experiences of service providers being within that system? And we do know we have a system with silos. So, we have different organizations within communities where there are different doors here reflected, and there could be parallel paths, really, each path by a different organization. So if you're a family, then you would be trying to access each one of these doors through, their own separate path. And then you would have a network of a group of service providers as well, and agency providers here represented in blue, who would again also be providing services to families as they enter their individual doorways. This is a bit of a siloed system though, and within that again are parallel pathways, multiple independently working agencies, the potential for service and support gaps, and feelings from families of some uncertainty and confusion. And through some of the data that we've collected over the years, I've heard the stories from families where the range of experiences of having difficulty in trying to connect with services or having a disconnect when they are referred to a different service, for example, and just leaving them with a great deal of uncertainty and frustration. On the service provider side, we see within that same siloed system the possibility to sort of stay in your own lane, to stay within your organization. So providers are really staying, within their own path. And ultimately, what that can result in is service providers and agencies working quite independently. It's associated with the fragmentation that we see in the service system and the potential for a great deal of duplication of effort and also resources. So in order to address some of these challenges, we know that there are efforts being made to work towards more coordinated and integrated service delivery systems. And we know through some of the work that's happened, for example, in 2012 with the BC Families First Agenda, there was a public consultation done, and the findings from that public engagement were, in relation to earlier services, was the need for enhanced integration and coordination of services to try and address some of this fragmentation and some of these service gaps. So we've seen some of the work in various communities in their efforts to try and create a more integrated system. And this has involved having families, no matter which door that they enter, whichever organization they enter, being able to access consistent information. And if they can't receive services from one particular agency, at least there would be a way for them to be able to get connected with that agency quite easily. So here we would also have service providers, but in this way it would look different from the previous model. So the model here being for families, every door is the right door, no matter where they go. They access that information and support. Service providers across agencies work collectively, in this case, to meet the needs of families. And it creates potentially, hopefully, a seamless experience for families. So if we were just focusing on the service providers within this, this is what it would look like. So here we have the possibility for interconnections between social providers. And a way to think about this is to think about this as a social network. And we can see that there are varying degrees of connectivity that can happen across organizations and providers. So as they start working towards more coordinated service delivery, we see those ties happening across agencies. And those can really vary on a spectrum. So you can have different levels of connection. So you see that they can become more dense. So some communities might have really many connections with other agencies within their community. And then you can have instances where it's a much sort of fewer interconnected ties between agencies as well. So this idea of different densities in networks, as well as the potential for differences in weak and strong interconnections. So that's just a background to give you a sense of the lens that we are using to start to think about community systems and looking at similarities and differences across communities. So our research focus is on trying to understand early years networks, these collaborative structures, in diverse community contexts. And some of the things that we're looking at are, what are the structures of these collaboratives? What are the structures of these early years networks in particular? What are the process that they're engaged in? What types of outcomes do they have? And also, what are the contexts? So under what circumstances? So thinking about not only the community context, but also the context for that particular collaborative. So those are some key questions for us. A sub-question related to this is a sub-research question is, to what extent are early years networks engaged in collaborative structures and processes that are facilitative of integrated service delivery systems? So wanting to bridge in that idea of efforts towards integrated service delivery as well. So how are we doing this? What are our research methods? We're really using a mixed methods approach, a multiple case study approach, which allows us to dig deep into selected communities to understand what's happening at the level of service delivery systems and structures and collaborative structures. Our intention is that we want to be able to understand these community level determinants to see whether this can contribute information to our understanding about those differences that might make a difference. And some of the data that we are collecting, it's qualitative and quantitative type data. We're doing interviews, focus groups, social network surveys, and we're drawing also from our developmental health trajectory data, as well as our community capacity building data. So once we move into the analysis phase, we're looking at those differences and similarities as well. And the goal is that we would really integrate and apply that knowledge. So that research to action piece that Pippa talked about at the beginning, that is an integral part of this work where we can build that knowledge and share it with communities and have it applied in some way is ultimately our goal. Knowing that it's a loop. So as we learn more and we apply, then needing to go back and understand further with gathering more knowledge. So I want to tell you next about selected cases. So today I thought I would provide some findings from 4 community contexts, and I want to tell you a little bit about the 4 contexts that I'll be talking about with you today. So 2 pairs of communities. Each pair is actually adjacent geographically, but what we also see is that they're consistently different in terms of their EDI vulnerability rates. So each pair that I show you, there'd be a consistently different EDI vulnerability rate between them. And all of these communities are small in size, so their population sizes would be under 10,000. And that idea was to start with our smaller communities, but the idea was to also eventually be able to expand this research so that we could also understand different types and sizes of communities, as well as communities that might differ in terms of some of their sociodemographic backgrounds as well. But in all of these communities, they're in geographic locations that would influence diverse barriers to access for families. So there are varying degrees of isolation, varying degrees of remoteness and rurality, and there are larger geographic areas as well that also are associated with some limits in services and programs that are available for families. So that's just something to keep in mind. I'm going to give you just a few snippets of information about each community. So our first pairing, Community 1 and Community 2. So both of these communities really share a lot of characteristics, but generally speaking, Community 1 is known for its natural beauty and outdoor recreational activity and active lifestyle. There's a decreasing population, and that we see some of the older members of the population leaving the area. It's an area known for tourism, as well as some challenges in terms of job insecurity, transportation barriers, and transient population. And those last 2 are common to both communities. And how participants themselves talk about their communities, isolation being a factor. It's a small community, the weather having an impact, and children being able to use a stroller, for example. It's not always a comfortable place to raise young kids. The community is geared towards activity, and it is considered very safe. What about Community 2? Similarly, also the natural beauty, appreciation of the great outdoors. In this case, though, in contrast, it has an increasing population, and more so than in the first community, a much more dispersed population, so spanning a greater geographical area as well. And I'd say for both communities, a sense of more of a cultural homogeneity. So we're not really seeing a lot of cultural ethnic diversity in either of these communities. And from the perspective of a participant in the community, it's a small town, but it has lots of services, and there's a lot of interconnection between people so that they're able to connect people to services in a quite straightforward way. Now, what about the next pairing? Community 3 and 4. So in terms of Community 3, Community 3 and 4 are actually just less than 20 kilometers apart, but Community 3 is one characterized as having a small town feel. It has a real mix of younger and older population, also transportation barriers, but considered very walkable, and it's a farming community. Viewed as very tight-knit, and a place where people feel like they take care of each other. Community 4, viewed as peaceful, yet one where there's a great socioeconomic divide. So there's quite a disparity there, with poverty being quite an issue. It's also a place where people might go to be off the grid. So people choosing to want to be more remote. It's also characterized as a supportive community and an affordable place to live. From the words of a participant, very community-minded, but a lot of issues, a lot of challenges that they're dealing with in this particular community. It's also rural and remote, and again, it has that big geographical area that they're trying to cover, and not as much access to services as well. So just keep those in mind in terms of some of the contextual factors for the communities that I'll be talking about with you this morning. So what were our cross-cutting themes? Our findings really centered around a few areas, and I'll describe 4 of them today. One of them being multisectoral collaborative structures, leadership, collaborative functions, and achievement of objectives. So for multisectoral collaborative structures, this is really the focus on the community tables. So those committees that are focused on early years work. Actually, I'm just wondering, can I get a sense of how many of you in the room are part of a table or committee in your area that's focused on early years, young children, or part of a child and youth? Okay, wow. We're in the right room. We're right in the right space. That's great. So I'm hoping this will have relevance for you. So what we did, so if you imagine that in your own communities, if you were invited to participate in this study, we would have mapped your table. We would have mapped it in a certain way, and this is how we would have done it. So this is an example where we found out which organizations or agencies were reflected within each of those community tables. And so this was just an exercise to see the composition, really, of who was involved. But as much as we're interested in the composition of those particular tables, we want to know that interconnected piece. We do want to know the ties. And so we would have asked each of those representatives from each of those agencies that are part of the table the question about who they are collaborating with most frequently. And this is an example where we have summarized the number of ties or connections that are happening between organizations or agencies within a single community table. And here we see a range, the largest number of connections being at 18, with the fewest number of connections by an agency being 3. So that's quite a range in terms of interconnections. But we're really interested here not only the number of ties, but we're also interested in understanding that composition of those multisectoral collaboratives. So who do we see reflected in this particular collaborative? Well, it's really quite diverse. In this case, on the left-hand side, which is where we see most of our interconnections or the most connected groups within that collaborative, we see childcare represented, we see health, we see education represented, and interestingly represented at multiple levels. So at a senior level in terms of school district, as well as at the school level. We see nonprofits represented. Also, we see citizens, city council, and Ministry of Children and Family Development. So when we think of cross-sectoral representation, this was an example of a community that had quite cross-sectoral representation, and also not only that in terms of representation, but a high level of collaboration happening in terms of the number of ties that were happening across those sectors as well. So that's the type of thing that we would note and characterize across each of these communities that we studied. Next, we wanted to map out those ties. So what I'm going to show you is a series of social network maps. So not maps that you would be accustomed to seeing from HELP, but more of the social side in terms of those interconnections. So here, this is Community 1. And this is where we've mapped out again, each square or node represents a single agency within a community table. What we've done is we've looked at the interconnections that have happened between those. So those with the largest squares are in green in the center, so where we're seeing the most collaboration happening. The next in size would be the next level of collaboration, and the smallest would be C, where the least amount of collaboration. And so if we break this down a little bit, we see that there are clusters of interconnectedness emerging. So we see at the very center, we see a clustering with the most ties connecting certain organizational members at the core of this network. And then we see another level in the blue of another layer of collaboration that's happening. And then we see those on the periphery who are involved, but not to the same extent as the other two clusters. What do we see in the next community? Well, in the next community, again by size, we see each node representing an agency, and we see those highlighted in the largest squares and in green representing those that are the most collaborative. And in this case, we see a cluster of about 10 agency members that are holding the majority ties with each other or interconnections. And it's quite evenly distributed. If you look at this, it's quite evenly distributed in terms of the collaboration that's happening. An interesting thing to note about this community, in contrast to the first one, the first community in terms of composition, again, had a very cross-cutting membership and representation in terms of cross-sectoral collaboration. This one was interesting because actually it consisted of a couple of umbrella organizations. So we weren't seeing as much cross-organization collaboration as much as maybe more of a cross-discipline, cross-professional collaboration. So when you look at those in the green, those actually represent two agencies, but they represent people from the same agency, which can show some level of cohesiveness when we think about a network, but it's different from the first in that kind of cross-sector, cross-organizational aspect. So when we look at the two together, I'll show you them side by side, and keep in mind that these again are two communities with different developmental vulnerability rates. And what I'll show you is the connection between them. So Community 1 is a structure, a collaborative structure associated with an area that has lower EDI vulnerability consistently. And Community 2 is one structure associated with an area with higher vulnerability. And just to note, I'm not making any causal sort of claims here, but it is one of those sorts of factors that we're thinking about and considering in relationship to possible differences that may contribute to differences that we see in terms of developmental vulnerability. Now, very tied in with this is the next theme, which was related to leadership. So leadership here, we focused on a few different things. We looked at structures of leadership in terms of those networks, but we also looked at things like processes for decision-making, for example, informal and formal nature of leadership. But what I'm going to focus on today is more the structural aspect. And what we saw emerge were different types of leadership. So one type of leadership was characterized as a power-based leadership. So one really where you see a cluster of agencies, representatives that work together to play a key role in guiding that table. The other scenario that we heard about was collective leadership. In that case, there was a lot of sharing. There was a lot of reciprocity happening across agency members. And they would take turns in terms of different members taking the lead or a share of the lead. So if we relate that to the structures, Community 1 was the one associated with more of a power-based leadership, or that cluster of leadership with a few core members of that network who were really leading and guiding that group. Community 2 was one where we see more of a collective leadership model, so more of that sharing and distribution. And so it's very much reflected by our structures. So we're seeing the core leadership here represented by this heart structure, and we're seeing the cross sectors represented here too. We saw multiple sectors represented at the heart, that core group of leaders. Here we saw more of a distributed model. So we saw 10 members who were really sharing that leadership. So quite a different model that served different functions, I think, for each community. But it's important to note as well that there's a context for this leadership. And there are a number of factors that need to be considered. So we need to think about the table itself. There was membership consistency and also some instability as well. And that could happen in the membership as well as in the coordination. When there's a high level of turnover, that will affect the context for leadership. There's also the issue of enmeshment, possible enmeshment with regional tables or structures. So 2 communities in this case, 2 of the 4, were tied in with regional tables, which introduced some challenges as well and was facilitating in some cases too. There was also the potential for enmeshment with a single agency. So it was difficult sometimes to have autonomy from a local table if they were too tied in with a single agency or viewed as too tied in with a single agency, or if there was a view that they were less autonomous because of the presence of a regional table. So there were some complexities there. Leadership also depended upon where the stage of development of that particular table was, or that early years table. So depending on where they were, that would affect leadership. Even something as much as meeting frequency. So what's the contact time between committees? In some cases, we saw committees meeting monthly, and in another case, we saw committees meeting 4 times a year. So how does that impact how much leaders are able to get momentum, how groups are able to gain momentum as well? Leadership structure, as I mentioned, that's very much like what we've been talking about, looking at those structures of leadership. The level of multisectoral commitment, as again I showed you, it varies in some of the examples. Member engagement, that's associated with the autonomy that tables feel and whether they feel that they can actually promote change. And then an important contextual aspect too is raised by some is the importance of historical context was early learning being part of the Ministry of Education mandate. And that in particular linked with ongoing school district interest and investment and senior decision maker involvement. So that was raised in some of our cases as being a key factor for having ongoing stable commitment from education and in particular from senior decision-making levels. And in this case, I'm not talking about a particular person. It's actually the idea of sustaining no matter who the particular person is making sure that it's sustainable in terms of having that membership of senior leadership at the table and a commitment to that over time. So next I want to share with you aspects and findings related to some of the collaborative functions. So what tables are actually doing with one another. And I want to embed this within that context of integrated service delivery and some of the functions that are tied with promoting a more integrated service delivery system. So what we've done here is we've drawn from theoretical frameworks in thinking about what is integrated service delivery. And we've understood it and conceptualized it in terms of a continuum. So having a continuum of integrated service delivery where on one end you might have that coexistence of separate agencies and organizations. So what we showed before, those parallel pathways with providers really in their own lane. Moving along in the continuum, you might see more coordinated service delivery. Maybe there movement towards joint service delivery and action, joint program planning, and eventually a state of integrated service delivery, where again you might see more of that network, the stronger network ties that are happening across organizations and agencies. Now, what we can do is we can look at some of the collaborative functions and activities that underlie this. So we can again look at this in relationship to the continuum. So coexistence of separate services, really, not surprisingly, little or no collaboration happening across agencies. When we look at coordinated service delivery, we can look at activities like information sharing, the level of case coordination at the individual child or at the family level, and forward on the continuum, activities like joint program development, and the extent that there's resource sharing, non-financial resource sharing and financial resource sharing. So this is what we did. We examined each one of those activities as a way to understand the extent that different collaboratives were working towards integrated service delivery. And so I'm going to show you a series now of maps that illustrate our findings. So the first function of collaboration that we'll look at is that first one. So early on in the continuum. So we'll look at information sharing and we'll go along the continuum as we go. So functions of collaboration in terms of information sharing. So how much are organizations sharing information with each other, networking? And we see here, this is a community one again. And again, keep in mind the way this works is the larger nodes reflect where we're seeing more connections between agencies. And here we see a lot of blue happening. So we're seeing a lot of activity in terms of multiple organizations involved in information sharing, and then there's very few along the periphery as well. And there we see that shows sort of the vast majority of this particular table involved in information sharing activities. Let's look at Community 2. Community 2. So here we see, again, large nodes representing information sharing activities. Vast majority, again, involved in this activity. And if we highlight some of the clusters, this is even more so a large number of agencies and organizations engaged in this activity. So if we look at them side by side, we'll see, again, with the context being a lower vulnerability EDI outcome with Community 1 and a higher vulnerability outcome for Community 2, we actually see that in terms of information sharing as a collaborative function of the network, there's quite a bit of distribution in terms of activity. There's actually quite a bit of similarity here, even though we see, there's more activity in information sharing in Community 2. Really, on the whole, information sharing is happening quite a lot in both of these communities. So let's go to the next activity and function of collaboration, which is joint program delivery. Here we'll see joint program delivery. You can see right away this network is not as dense. So there's not as much activity happening. And we see that there's sort of a cluster here of agencies that are engaged in joint program delivery, and then a few that are sort of on the outside. If we look at the next community, which is Community 4, we also see a cluster of agencies working together towards joint program delivery. Now, if we look at those communities side by side, Community 3 and Community 4, with Community 3 being a community with lower vulnerability in terms of EDI, and Community 4 being one with higher, again, we see that there are a lot of similarities in the look of these particular networks. Both coalitions report multiple interconnections in terms of joint service delivery. So not a lot separating them in this area. Let's take a look at functions of collaboration in terms of case coordination. So again, we're moving along that continuum. And this is Community 3. And here we see that the majority of this community is actually engaged in case coordination activities. We see that there's particularly a cluster of 4 agencies that's really engaged and involved in case coordination, with another cluster emerging around them that's also involved. Let's look at what's happening in Community 4. Community 4 looks quite different. As you can see, the number of ties across agencies is much fewer. And if you look at the shape of the network, it's actually a straight line network. So really, when you're looking at case coordination, it's one agency maybe referring to another, rather than an agency involved in multiple agencies to work on case coordination. So again, a simple straight line network is emerging for this one. So if we look at them side by side in relationship to EDI vulnerability, we see Community 3 is our lower vulnerability EDI rate, and we see Community 4 with a straight line network being one with a higher vulnerability. So again, we're seeing a difference here in not only the density of the ties across networks, but we're also seeing a difference in complexity. So we're seeing much more interconnections by multiple agencies than we are seeing in Community 4. So I've shared with you findings about functions of collaboration individually. So those individual functions of information sharing, joint program delivery, and case coordination. But what about if we looked at them all together? What about if we think about that in terms of being a stronger tie when we see all of those activities happening across agencies? So this is what we find in Community 3. And this is something we refer to as multiplexity, as a way to understand strength of ties in social networks. So here, this is where we have overlaid networks on top of each other, really, and try to identify agencies that are involved in information sharing, joint program delivery, and case coordination. And this is what we find. So we see here that more than half of this network is engaged in all 3 collaborative functions with other members. So what do we see when we look at Community 4? Community 4, we see much less activity again. So when we think of the interconnections that are happening around those 3 activities, it's very thin. There's only 3 agencies involved, and again, it's an agency-to-agency connection, and not a lot of multiple interactions happening. And all of these agencies reflected here, those are just ones where they're not involved in the network at all. So we see the vast majority aren't involved in all 3 activities at the same time. So few network ties interconnect the organizational members across 3 types of collaborative functions here. And we see a lot of non-linkages as well. So when we look at them together, here again, we see quite a stark contrast. between our Community 3 and Community 4 in terms of the complexity of the network, interconnections, and the shape as well. Straight line versus more complex interconnected. The next collaborative function that I want to share some information with you about is resource sharing. So resource sharing was identified as something that's very important, not only in terms of the financial resources, but also the importance of human capacity, really highlighted across our communities the importance of the people themselves, the skills, the enthusiasm, the innovation that's happening. But financial resources were certainly highlighted by various communities in the importance of being able to move to action. And so the next networks maps I'm going to show you are related only to financial resource sharing. So this is what we see in Community 1. Community 1, so here we see a clustering around like 7 agencies that are involved in sharing financial resources with each other. So 7 members of this community table involved in resource sharing. And we see a number of others as well. So even when you look on the periphery, you still see these agencies that are involved, maybe one-to-one with other agencies. But still, in terms of activity for resource sharing, there's the high proportion of agencies within this particular table are sharing financial resources with each other. If we look at resource sharing in Community 2, it looks a little different. So here again, we're seeing that we do have multiple agencies involved, but the shape again is very different. So we're seeing a lot of these straight line networks. So more single agency to single agency connections around resource sharing, but not as much around multiple connections. So if we look at the 2 again, Community 1 being our lower vulnerability community and Community 2 being our higher, we again are seeing some stark contrasts in the networks themselves, which have been interesting to observe. What we're hearing from communities is the financial resource piece is important. Some communities reporting that the lack of funding is difficult to deal with and viewing it as an inequity in terms of some communities consistently having maybe a higher share of money, which affects their own ability to be able to move forward when they feel like they don't have as much, and they feel that they should because of the needs of their particular community. There was also the idea that these financial resources are important in terms of making change and needing to have those resources to be able to pay people to make change was something that was also highlighted by our participants. So I've showed you sort of the network maps part of it, but we can also assign some values to all of this, right? So we want to go add some numbers to this if you like numbers. So collaborative functions and ways of working together. I mentioned density. So we can actually assign values of density to these network ties. So here I've outlined on the left column those functions of collaborating, like information sharing, joint programs, case coordination, and resource sharing. And what we see by far, information sharing is definitely the densest network across all 4 communities. All 4 communities are engaging in a high level of information sharing and networking. What we see, though, is as we go down the list, we go down by each row, we see substantially fewer interconnections around those other functions that are associated with integrated service delivery. So a drop in terms of joint programs, a drop in terms of case coordination, and the fewest amount of interconnections around resource sharing. And this is reflected in each community as you can see a drop in terms of having high density for one information sharing and very low in terms of resource sharing. What about in terms of achievement of objectives? So that was some of the things in terms of process of what coalitions or tables are doing with one another. But what about in terms of what outcomes are? What have they achieved? What we heard was there's some differences there. There's some differences and there's some similarities. The similarities being that promoting community awareness about the early years is something that cut across all of the communities. And some would view it as their biggest accomplishment. Some tables viewed it as their biggest accomplishment. But there were others that were also adding other types of outcomes, which may be viewed as like tangible outcomes. So moving beyond community awareness to things like promoting playground revitalization was one example, where the entire community had their playgrounds revitalized. Those were sorts of outcomes that were different in that it wasn't just about awareness building, it was actually a little bit more concrete in terms of an outcome. And others that were, another example would be around movement towards more integrated service delivery. So there were activities in place where they could put together things like a coordinated community calendar, for example, or coordinated events where we could see more activity, more action. But all of this is affected by capacity. So there's the human capacity and there are actually the resources to move beyond information sharing, and that wasn't possible. So as much as we have tables that want to move towards that in terms of tangible, concrete outcomes that go beyond community awareness, there was a feeling that they really weren't in a position to do that because of lack of resources, whether that's human capacity, that's the time, and there's also the financial. There are also other factors that are influencing achievement of objectives. So in some cases, there were reports of just a lack of direction, some disorganization, and a lack of understanding around the structure around different types of roles. Contrast between communities in whether they had a shared vision or not. Some reported that their particular table didn't have a big picture in mind. Some that talked about having, couldn't really comment on achievement of objectives because they said they didn't really have stated objectives. So they were working towards that. That ability to move from talk to action really differed between our communities. And as much as there was the intention to do that, there wasn't always the feeling that they could. And also highlighted by a couple of the communities as well was this need for a system of evaluation and assessment. So something that could help them in terms of a guide that could help them to determine what some of the priorities or objectives could be within their areas. So those are all the themes that I'm going to talk about today. I'm just going to look at the time. I think we're okay. But just to summarize, going back to where we started, which was, the impetus for this work being, what kinds of differences might make a difference in terms of developmental health vulnerability inequities that we are seeing. And what I've highlighted for you today is just an effort to try and dig deeper into some of those 5 factors that Joanne and Clyde had talked about with some of the research evidence that we've been gathering. So here, this is a summary of the four themes that I talked about, and just to reflect that these are all very interconnected. So multisectoral collaborative structures would influence the leadership structures as well, and the processes and activities that they can engage in, with resources being a key part of it. And all of these in turn affecting the ability to achieve different objectives. So some of the things that are highlighted in terms of multisectoral collaborative structures, some of those differences that may be making a difference that we could be considering is that diversity of membership, ways to promote stability and consistency in that membership, decision-making capacity, clarity in roles, and the extent that there's shared vision and values. What about in terms of leadership? What are some things that were highlighted there as potential? We certainly saw differences in leadership structures. So I hope you saw through the networks some of those differences in structures that we've observed. Presence of unclear or lack of leadership. The shared leadership model or the core or centralized leadership model. Thinking more deeply as we move forward about what are some of the functions, what are some of the associated processes that go with each type of structure of leadership. When we think about those collaborative functions, so those activities associated with moving towards integrated service delivery, to what extent, and we saw differences here, in engagement in functions that are beyond information sharing and network. So we were seeing where there were some communities that were engaged in multiple diverse functions associated with integrated service delivery, and others less so. And this idea of diversified funding sources over time. So in the networks that I showed you, we saw that in some communities, there's a fair amount of resource sharing happening within that community table, that collaborative structure. So there are members of those tables that are able to share resources, and they're able to work together, as well as try and solicit external resources. And one of the things that also distinguished some of the communities is that ability to obtain the funds, but also that continual drive to keep applying for funds. That was something that came out in terms of that continual effort to try and keep applying. Whereas in other communities, we didn't see the capacity to actually even put those applications together because of those resource limitations. In terms of achievement of outcomes, differences in types of outcomes that were reported that were being achieved, those differences in being able to move from talk to action. I didn't talk a lot about this, but also differences in terms of internal and external legitimacy. So receiving that recognition from their own community as a form of external legitimacy, that they played an important role in their community, that early years played an important role, and this table played an important role in supporting the early years and the trajectories of those children onward. As well as internal legitimacy. So do people on the table believe in what they're doing? And we saw that there were differences in feeling associated with some of the disorganization and role confusion, some of that questions around internal legitimacy. And then finally, that idea of assessment and evaluation of progress with course corrections, some differences for sure in doing that, and also expressed desire to have more of that. So what we hope through all of this is, going back to the slide that Pippa showed, is that this type of knowledge that's generated by community and across communities could be something that could be shared and could have implications for potentially informing practice and policy. And we hope to be able to share this knowledge not only with the communities that we engaged in, but across different communities to see whether there is a way that we can help promote this knowledge to action, research to practice sort of continuum. So where are we going with this work as we look ahead? Well, as Pippa mentioned, we were very fortunate this year. We got a couple of grants from the Social Sciences and Humanities Research Council of Canada, which is terrific. So we have 3 to 4 years ahead of us where we can look at selected communities again and start to dig into community systems and collaborative structures too. So that's part of what we'll be doing. But as I mentioned to you, we started with very small communities. So the communities were all with a population of under 10,000. The vision for this was that we would want to look at different types, different sizes of communities, because what may apply in a small community may not apply within larger communities. So that is part of our broader vision for this work. We also know we were in very rural, remote areas. So what would this look like in more of a larger urban center, for example? So being able to look at this within different centers with different levels of sort of urban versus rural, for example. And ultimately, what we hope to do is be able to generate information across different communities. So we would have information about structures and processes and outcomes across different communities, and really be able to understand some of those functions, as well as the pathways towards more integrated service delivery. And part of this work is also related to wanting to understand those challenges that may be faced by specific communities. And those may be very unique. But we also recognize that there could be other types of challenges that are common across multiple communities and populations. And so we really want to engage in this work, so that part of that digging deep with this multiple case study work is to be able to understand what's happening in terms of those unique drivers and factors at individual community levels, but also eventually being able to look across communities and come up with sort of a body of knowledge about cross-cutting themes that may be informative across communities, regardless of size, or in terms of composition as well. So that's one of the goals. And we also hope that this information doesn't stay within community, is that we can be part of a process through this knowledge to action approach, where we can help support knowledge sharing about what's happening in terms of promising practices within each community, and be a facilitator of sharing that knowledge about the uniqueness and also the commonness of what's being experienced and what's being done in terms of community action. So I am going to close there, and I just wanted to thank you all for this time to be able to share information about this work. And I also wanted to acknowledge members of my research team who've been so terrific in gathering the data, analyzing the data, and so on, and also members of our knowledge translation team who've been so awesome in terms of helping with this slide deck and preparations for today. And also a big thank you to our funders as well. So the Institute for Health System Transformation and Sustainability, as well as the BC Provincial Office for the Early Years. So thank you very much for your time.
So I'd like to say a huge thank you to Brenda. This work has been emerging for, as she said, there's been a long history to this work, but the amount of effort and time that's been put into it over the last 2 years in particular is in large part due to Brenda and her team, so thank you very much. And I think the other thing that for me is so important is that what Brenda's building is a bulk of knowledge that allows us to be way more reflective. We've always talked about what we think is going on, and I think what's so important now is to be more, in some ways, scientific and more intentional about understanding what's going on to support us in our own personal reflection, but also in the work that we do with our collaborative groups and the communities that we're in. So I think there's real importance to continuing this work to support all of you. We do have a couple of minutes for questions. Is there anything burning either from the webcast or anyone in the room that they wanted to sort of quickly ask Brenda about the research or about any of the findings? Yeah. There's a mic just coming down behind. If you could use it, it really helps the folks on the webcast to hear what you're asking. We'll repeat the question. Yeah.
Sure. Oh, sure. So the question that we got was about the measurement of some of the networks that we generated and how it is that we defined collaboration within this context. In this case, we defined it along some of those collaborative functions that I showed you. So we broke it up, but we chose those in particular because they are ones that are associated with that pathway to integrated service delivery. So we know that there are many different types of collaborative functions, but we were being quite deliberate in choosing some because our interest was really in promoting service delivery structures and integrated service delivery models. Thank you for your question.
Oh, there is a question. Joseph.
Hi, Brenda. Thanks for that. Really interesting. I didn't follow in your distinguishing in those four communities the differences in the capacity of coordination that was bringing together those partners and what the importance of that would be in I guess, the accomplishment of bringing those groups together.
Mm-hmm. Yeah, no, thank you for your question, Joseph. I would say that coordination was highlighted as it's a key role within each table. To a different extent in terms of leadership. So the coordinator wasn't always identified as the leader of that group, but certainly in facilitating the structures themselves, implementing the collaboratives, making sure that the collaboratives happened with a regular frequency, and facilitating the members to come together and to have the leaders together and making sure that everybody had information. So I'd say the coordinators played a really important role. The challenges were the turnover that happened. And so we saw differences in coordinators sort of being long-term in their roles versus some that really changed very, very frequently, and how that affected sort of the ability for that particular table to move forward.
I just wondered whether or not you had seen any difference in whether the coordinator was jointly funded by different partners or singly funded.
Yeah, interesting. No, we didn't look at sort of the source of funding. We had differences in terms of hours. That's what we heard about. So the limited number of hours, for example, definitely played a role. If a coordinator said they only have 5 hours in that week to be able to support the table, then that had a huge impact. Whereas we saw that when tables had resources shared between, like amongst the table, they could contribute to the role of that coordinator in a way than just relying on a single source. So that resource capacity also influenced the coordinator's role too, and the extent of it.
So I think we'll close there for a break. Maybe we could say thank you again to Brenda.